Oh, I thought I could smell a cyclist. Let's have a little look.
Fellow biking fanatic Gary has come to Casualty following a crash.
Tell me about this accident.
I was riding down a very, very steep hill with a bend at the bottom.
Yeah.
And overshot it down the track.
So did you just overcook it?
I was just going too fast.
Right. You don't look like you've gone down on your side.
I didn't come off because the hill was too. I knew I wasn't going to make the hill. So I took a track instead.
Right.
And there was a sort of metal barred gate
that took your chin out.
That's what I
Right. Okay. So you stayed on the bike.
I stayed on the bike.
Good man. I've treated lots of cyclists and they recover really well. Yes, I do love the banter, the chit chat.
Unfortunately, I've got a Joe race wheel that's got a lot of damage.
Oh, that hurts. Just know.
What's the worst you've done then, bike accident?
Oh, right. Do you want me to tell you? Okay, the worst things I've done. I had a fractured neck of femur, which is in Italy. I was doing the Milan-San Remo Gran Fondo, fell off, was in hospital in Italy and having an operation. Just before Christmas, I fractured my hip socket, my sit bone, and a bit of my pelvis as well. I've got a season ticket to the physio department. I know all the physios by their first name, and I think the staff have a lot of fun at my expense. I've been advised to use tricycles, hip protectors, take up tiddlywinks. Okay, let's just have a little look. This is a mere scratch compared to that, I'm afraid. So we're going to need to put some stitches in that. That'll take 2 minutes. Let's have a look at these teeth. Okay, oh yeah. Right, you have to see a dentist about that. Your lip, I think we'll probably just leave that alone. It's not looking too bad. So the main thing is, get that sorted out, give it a good clean, get the Yorkshire grit out of it. Let's have you next door and we'll clean all this up and make it better for you.
In treatment bay 3, Dr. Humphrey is patching up fellow cycling enthusiast Gary.
Right then, let's get this show on the road.
After he crashed head-on into a metal post while out cycling.
Right, so what we're going to do is going to make it nice and numb. Then I'm going to give it a good clean, and then okay. That's it. Sort of put that round you. Right, so first things first, I'm going to put this anaesthetic in. Oh, a little scratch then.
Oh, that stings.
Yeah, okay. So the stinging is the worst bit. But for someone who's had multiple injuries, this is nothing. Yeah, that should be starting to get numb now. Right, scrubbing time. I do love the practical aspect of my job a lot.
Oh, it's not a toothbrush you're using.
It is a toothbrush I'm using. I find it's the best way of getting into these wounds on the face. You never know what's lurking in here.
I thought you people subcontracted the suturing these days.
What, to nurses? Well, cyclists always get preferential treatment. Don't tell anybody. If there's a chance to do it, then I'll sneak the patient in and do it myself. You know. Don't tell anybody else that, will you? Last one, I think, for you. Right, so I've put 4 stitches in, okay? And these stitches need to come out in about a week's time. Your looks have been restored.
You're a miracle worker. Which year?
I've been trained in plastic surgery.
Can you do 1982 for me?
Yeah, that was a great year, wasn't it? Right, you're finished.
Thank you very much.
No problem.
Pleasure.
Okay.
Is that okay?
A patient with serious head injuries is being brought into the casualty department, requiring urgent treatment. 53-year-old Dean is taken straight to resus.
Come across on 3. 1, 2, 3.
This Dean is fell in the street approximately 45 minutes ago. He's got a laceration to the forehead, one there to the bridge of the nose, which you can see.
What have you fallen onto?
Road.
Road? Yeah. Just straight onto the road, onto the curb or anything?
No, just the road. I don't do things by halves.
No. Now, since you've had a blow to the front of the head, we have to be very careful. We can't rule out whether there's a bleed on the inside, and you may come in feeling fine with that and then only go on to deteriorate later. So for that reason, we're going to do the scan.
Dean is sent for an urgent CT scan because a bleed on the brain could be life-threatening. In resus, Junior Dr. King is looking after 53-year-old Dean, who's had a bad fall.
Your teeth feeling okay? Do you have any pain in your neck at all?
No.
Heart-wise, we're stable. I don't think that's anything to be too concerned about.
Yeah.
But doctors are worried Dean might have a life-endangering bleed on his brain. He's just had a CT scan.
I'm happy to do the suturing up now. Do you have a modelling career at all? No. You sure? In terms of how you interact with a patient and how you communicate with people varies. I certainly have a different bedside manner seeing maybe an ill child and a worried mum than I would seeing someone who has fallen over.
The CT results will be in soon. If there is a bleed, Dean will be rushed into theatre.
Do you feel comfortable enough there?
Yeah, but I'm not looking forward to it.
If you were looking forward to it, that would be a bit strange. That's stinging a bit. You doing good there, Dean? You feel me touching this here?
Touching it where?
Good. Here?
No. Just carry on.
Can you just relax? Imagine you're somewhere nice. Does that feel okay?
Yeah.
It will feel a bit weird. You can feel some pushing and pulling.
It's okay at the moment. It's okay.
It's good.
When he fell, Dean was rushing home for a rather unusual delivery. 2 penguins.
I collect ornaments and wild animals.
What sort of wild animals?
Tigers, leopards, elephants, Louis Vuitton, not 2 penguins.
You got space for all these in the house?
There's only me who lives in the house, so...
Alright. Just you and your zoo.
Yeah.
Okay, stitching's all done. You're a pretty picture.
Junior Dr. King is now able to review the CT scan images.
I've had a look through that myself. It looks okay to me.
Good.
We do wait for the radiologist to officially report it. But I
Yeah.
can't see anything big and obvious on there, which is a good sign as well.
Right.
We're going to get you cleaned up and we will look towards getting you home this evening.
Yeah.
Okay?
Yeah, that's fine.
But any problems that you want checking out, come back here and we'll be happy to see you again.
Yeah, right. Thank you very much.
So it's probably a gradient like that.
Yeah.
And he's gone down at pretty fast speed and hit it. That's what I'm worried about really, the impact, it knocked him flying back. I'm just so annoyed at myself.
I've been really lucky actually since I've come back. I haven't had to look after a really sick child or a child that had a poor outcome that's the same age as my children, but actually sometimes in work even just a kid that cries in a similar way to mine will I just get a little kind of tug at the heartstrings.
It was a solid wall.
Solid wall, okay.
It's a bit of a shock. to be
Can you
honest.
see down to skull?
Yes, yeah. Yeah, you can definitely see it.
You alright if I start taking his dressing up? Yeah, that would be great. You can make him cry and then I shall come in and try and fix it.
4-year-old Teddy is in Pediatric Bay 2 to have a head injury stitched.
Oh, look at you in your awesome bandage. You look really cool.
Something his mum can't bear to witness.
Hello, are you Dad? I'm Jane, I'm one of the consultants.
Oh no, they made you cry.
So we have a plan of action. So plan A is to try and do this without making him sleepy. The gel that we've got on is pretty magic and it often works quite well. Often in slightly older kids. Does it feel me touching you? No, does it not bother you? It's good stuff, that cream, isn't it? Would it be all right if I just gave it a bit of a clean? It's just trying to get all of that hair out the way, isn't it? Well done. Oh my goodness, you are like a superstar.
Spiky hair in there.
Have you got some gel for your hair? Do you like it?
Oh, thank
I
you.
just let Daddy have it. Oh, do you let him borrow it? If Daddy hasn't got any of his own, do you let Daddy borrow it?
Right, my arms just might get in the way. You keep looking away.
Sorry,
sweetheart.
You're going to have to go home and tell your brother and sister how brave you've been. And I think we might have...
Let's just get that little bit of blood so it doesn't get in your eye.
Shall we see if you want to choose a prize when we finish to take home with you? Yeah, you want.
Goodbye.
I'm just going to try and not cut your hair. I don't want to give you a funny haircut.
No, because we need some hair to put that gel in.
Goodbye.
Oh, do you want to stop and have a cuddle with Daddy and we'll decide what to do? Yeah. I think we've probably just got to put one more stitch in. Or do you want us to give you some meds and make you sleepy? What does Daddy think?
Should we do it?
One more try. Well done, sweetheart. That's all the stitches in. What a superhero you were. Can I have a high five? Right, I'll come back and check on you in a minute and make sure you're all stuck back together properly and then we'll be able to let you go home. All right then. Bye-bye.